Curawave, or MR-guided focused ultrasound ablation, is one of the newer techniques that we have of non-invasive treatments for fibroids.
The MR-guided focused ultrasound machine is actually two components. The MR part of it is the MRI machine, which is the best way we have at looking at anatomy. And that's actually how we diagnose your fibroids and the size and location of them. And then there's the focused ultrasound part. And the ultrasound is just like the ultrasound beam that we use when you're pregnant or for looking at gallstones. But instead of the beam going across the whole pelvis, we actually make the beam converge at a focal spot. We can target that focused ultrasound beam into the fibroid in a very, very specific manner. We can make that target area the size of a grain of rice or the size of a coffee bean. We can visualize the beam going right into that area, and then we know that we're not hitting any of the surrounding soft tissues. Even 1 or 2 millimeters away is left completely intact.
So the Curawave experience is often quite comfortable for most of our patients. You walk into the facility, you've gotten prepared for your exam, brought into the examination room, positioned, you're on your belly for the entire procedure, which generally lasts an average of about 3 hours. Occasionally, there is some heating and or some cramping, but there's a nurse in the room with you at all times to help you through that process, and there is some light medication that can be administered.
There are two things that happen to the fibroid after the Curawave procedure. The first thing is that we try to kill as much of the fibroid during the procedure as possible. So what happens after that? Well, two things. Number one, it shrinks over time like a balloon letting out air. So commonly in our body, dead tissue is resorbed and gets excreted in our waste. So there are these cells, or these Pac-Man cells, that come up and eat up the dead material, excrete it, the fibroid shrinks. The second thing that happens is that this fibroid doesn't have any functional tissue anymore. So patients feel better immediately, partly because the weight of that blood flow in the fibroid is no longer happening, and then that fibroid no longer responds to all the hormonal agents in our body.
So once the procedure is done, then the patient's taken off the table and recovered for a short period of time. And the joke is that often most people are feeling so well and so much like themselves that they're planning where they're going out to dinner. And then you walk out of here just like you walked in, and most patients resume their normal activities, work, their normal lives, etc. the very next day.
The FDA has approved the MR-guided focused ultrasound procedure to be performed here in the United States. There are places in California like Stanford that perform the procedure, in the middle of the country at the Mayo Clinic, and on the East Coast at Duke as well. So we're in very good company.